we're going to be talking about an iStat and how to run a test on the iStat. And the reason this is requested based on CALS training in case there's a patient that comes in and is a very big trauma or code and you need those lab results tested right away. So this is our iStat cartridge. It's a Chem 8+. It does a sodium, potassium, chloride, ionized calcium, glucose, BUN urea, CO2, creatinine, and a hematocrit. And it'll do an ion gap and a hemoglobin as well. So in order to run this, the supplies you're going to need is your iStat, your cartridge, a pipette. And these will be in a bag on the cart for you that we take off after hours when the cart comes from the lab to the ER. Then you have your tube of blood, which needs to be a green top tube. It needs to be filled at least halfway. And when you draw it and collect it, you need to make sure you're mixing it after collection. So now we're going to go ahead and talk about this cartridge. When you go ahead and open the cartridge, you need to use it immediately. It is at room temp. It's good for 14 days. If it comes out of the refrigerator, it has to warm for 5 minutes before you can use it. But we're going to have one in the bag for you to use at the time when you need it. When we go ahead and we'll start doing our testing, put your gloves on because it's very important that you stay safe. And on the iStat, this here is your power button. So you're going to go ahead and turn your power button on. And then as you can see from the test menu, you have your last result or your iStat cartridge. So what you're going to do is we're running a cartridge, so you want to go ahead and hit number 2. You're going to want to enter your operator ID, which is going to be the last 3 on your badge, just like you do for your glucose meter. And then you're going to hit the enter button. That way we can track who it is. Then you're going to enter your patient ID, which is your medical record number. And so we'll do 1, 2, 3, 4, 5, 6 is what we're going to use for our practice medical record number. Hit the enter key again. Then it's going to say scan cartridge lot number. You're going to want to hold your cartridge and then you're going to hit the scan button. And what it's going to do is it takes that red and it reads this information on the top. If it doesn't scan it, you can always hand enter this number on the top on the keypad. So now you're going to open your cartridge. Here's what your cartridge looks like. It's got a thumb place here for you to put your thumb. This is the electrodes where it does its testing. So do not touch the electrodes and do not squish any of these parts because that's where the reagent is. You just want to kind of basically hold it where that thumbprint is. So then you're going to lay your cartridge flat on the counter, mix your specimen up, grab your pipette, then you're going to draw up probably the 3rd or 4th line. But what you need to do is when you fill it, you're going to fill, there's this little hole right here. And what you want to do is you just want to fill it in this line, and you want to fill it. And what it will do is it'll wick up. There's a little line here where it comes up, and you just want to keep filling it till it goes all the way up to that line. So it charges itself, so there should be blood all the way up there. Then you dispense that back in the pipette back to the blood, and you're going to then flip this and close it. That completes your test. You're going to go ahead and put your cartridge in the bottom and it slides in like that and it clips in. As soon as it starts reading it, it'll say identifying cartridge, please wait. And now it's going to start running your test for you. So right now what it's doing is it's pulling that blood that you had put in here. It's going to sucking it up through all the electrodes. So start running your test. So now it's started. You'll have results in 2 minutes. And what you're going to do is there's no printer hooked up to this at all. So you're going to have those results there that you can document. The machine does shut off after a while, so you can always turn your power button on. And instead of hitting option 2, you can hit option 1 so you can look at what those results are. You may need to page down to the 2nd page to see the rest of the results.